And Dr. Williams is here, so I'll turn it over to him for some brief remarks.
Right. Good afternoon. Dr. Yaffe's on a federal provincial territorial call, so I'll give you the numbers and some comments for today. It's Thursday, so we're asking how did the week go, and then what are we looking at on the weekend coming up, and of course the week coming up. And for a lot of people, the focus is on school reopening. In some areas have actually opened up today, in a few areas in that. So there is a different opening in different parts, so we'll be commenting on that as well. So numbers. We have been remaining above 100 almost every day for the past 2 weeks. As we had that back about 3 weeks ago, we dipped down to under 100. And today we saw about the same as yesterday, an increase of 132 new cases. 119 resolved, and fortunately again today, no deaths reported related to COVID. And that again continues to be encouraging. So again, as in the past, while we've seen 31 health units all reporting 5 or fewer cases, and 18 are reporting no new cases, and some have been doing that for a number of weeks in a row now. That's encouraging. Most tend to be concentrated in the larger urban centers, such as Peel, which had 45, Toronto 31, which is down a bit from what they were yesterday, and Ottawa up a bit to 22. And the cases being reported, the vast majority were under age 60, but we're seeing some increase in some of the older age groups as too, a little bits in numbers there as people are being, I think, are getting a bit more lax in watching and observing the precautions that we've always emphasized throughout this time. As of the 23rd of August, still we had 234 cases totally under 19, 542 have been the 20 to 39, and 361 between the ages 40 to 59 since August the 23rd. So that's a cumulative over that time period, not in one day, of course. Listening to the local medical officers of health, and I'm always in contact with them, and they're continuing to give me advice and direction. They're saying most are related to private gatherings and outbreaks in workplaces. So I was just checking with Peel, and they'd seen some increase in cases. One is related to a church-related outbreak, because their number went up quite a bit, and others related to a workplace outbreak. So we continue to see these events where people are being less than cautious in their gathering, not doing the distancing outside their social circles, not wearing masking when they're in those areas there. And so there still is robust transmission from person to person in those settings that is in contradiction to our public health measures recommendations that we have made. And we've said, even though we're in stage 3 and a number of weeks now, we need to be really dedicated to working at this, especially as we're going to Labor Day weekend. And as people may say, well, end of summer, not officially, but in that Labor Day weekend to be really take more casualness. I wouldn't strongly recommend against that. Why is that? And we're in stage 3. We're really trying to set the stage to keep that number down and to maintain all those public health measures as we go in, because we want the community rates down low, because the community rates reflect some of the concern we might have with schools. And we want to make sure those stay down and even get down lower if we can, because that's our focus for the next while. Schools and, of course, post-secondary school institutions opening up. So we want to make sure we do it again, and keep doing it as we go forward. In relation to the schools and teachers returning, and we've been talking about this, Dr. Yaffe and myself, at that preparing to go back. Some are back, some will be going back next week, some a little bit later. And we continue to get advice from our Ministry of Education counterparts. And we're putting together our own task and working group that would combine Ministry of Education, public health field units, experts and people to look at issues that may arise in relation to COVID in the school system and child care setting as we go forward into the fall, as the influenza season is approaching. But again, I've been looking at our respiratory virus data from our national center, and amazingly very low across the board. So that's reassuring at this stage, but it means it's still coming. So we're asked about what we want to do at this time. Again, preparing for school opening. That means talking to your children, much like we used to get lectures as kids back about how you're supposed to behave properly in school and all the things you're supposed to do, and remember to bring your projects home and different things. So those are still going to be probably talks and discussions. But now it's the infection prevention control aspects, about masking, about distancing, about only associating within your cohort or your group or classroom, whatever is that defined number is, and about proper thing if you're taking transport, what to do, and other things around washing your hands. What do you do if your mask gets soiled or dirty? The extra one you probably have in your backpack, where you can get another one from, because the school will be able to give your child one, as you understand, if both their ones that are with them are soiled or they haven't got one. We want to make sure everybody has what they need. Besides that, one of the key things, if we look at the concept of cohorting, and we're asking for a public measures table to look at it on a wider perspective, but as we do that, we know that in your cohort, in your circle, you have a trust relationship. You have kept your contacts down to within that group. You have not exposed the group to external infection. You have maintained your own health standards. If you are unwell, you stay away from your circle and you notify them accordingly. And so now you're asking your child or children, if you have more than one in the school system, they're going to enter into a cohort, whether it's in a certain grade or high school or social study group. And therefore that preparation before that occurs is one, as people have done in the past, make sure you maintain the vigilance in your social circle so that your children have not had contacts, have not been put at risk. You haven't either as a parent. And so they're prepared. And you hope in that, and the plan is that your trust in that is with your fellow parents in the same cohort, they're doing the same thing. So in a way, you want to engage to bring that to a good start in that process. And the same as the teaching staff are doing their care and precautions as they get to enter into that cohort as well. So a lot of things to do in preparation before you go, and as well as when we're monitoring in that process. And I know in our federal, provincial, territorial meetings, we're comparing notes from across the country from what they experienced with British Columbia, what Quebec is experiencing now, and some of the territories and areas, as some of them have already opened for 1 or 2 weeks already. And so across the country, a lot of the issues are the same. Still desire to make sure that children are back in the school in a safe way, monitoring, assessing, and informing ourselves as individuals, the different public health sectors across the country, and we learn from each other, and we continue to be informed by the broader consensus of our group, and also from our Ontario experts here in Ontario. So, again, the use of masks, the distancing when going to school, in the school, and following the rules and the movement around in there. Much to be worked out with the infection prevention control. We have our public health nurses being hired, and they're coming in, and we're getting those staff up and trained and ready to go to work with you in each school, so you know who your public health nurse is, how to contact him or her, and how to make sure you understand that you can approach them and the health unit to ask for more information and advice. The key thing is that you need to be kept informed, and your questions, we would like to make sure they're answered either by ourselves or by the school administration or by the Board of Education in the areas of your concern and anxiety in that regard. So we have set up our processes of how to carry out identifying cases, what to do with illness in the school, what to do with a case in a class or cohort, what to do with a number of cases in a school, when to declare an outbreak in a cohort, when to declare an outbreak in a school setting, and how to handle that at a local level and a regional level. Because our public health nurses are attached to the case contact team at the local health unit. They're attached also to their other experts in the health unit, including their AMOHs, Associate Medical Officer of Health, and the Medical Officer of Health. So you have a cadre of resources to go to. So I can understand why people are anxious and want to see what's going to happen. A number of things we haven't determined yet. And as far as our IPAC people, we want to see, as we always do, what is it like actually when the school's up and running? And we want to check that, look at that, see how that's going, give advice, give direction, and give suggestions, do problem solving, and make sure things are starting off as safe as possible and continue to be safe as we go forward and deal with any urgent issues or aspects of concern as quickly and as expeditiously as possible. So, the weekend, enjoy, be careful, do what you need to do, follow the public measures approach that we said and over again. So don't let down your guard. School-wise, get prepared, maintain your distancing, maintain your social circle, make sure your children are prepared in all ways to go to school, and that means all the people and the staff and related to the school programs and the child care as well. So much to do, and we're looking at how our post-secondary school institutions are welcoming their students back. And I see lots of great ideas that they're doing around virtual frosh and different areas there too. And I applaud them on those safety measures they're undertaking at this time. It is different for them. It's unique. But these are different times, and they're unprecedented times. But I applaud everybody in Ontario for doing their part. That's brought us down to our low levels we have now. But I still think we have to keep driving it down even further, and we hope to be able to achieve that as we go into the fall, now out of this part from third stage as we go into school openings. So with that, I'm going to take questions from the media.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
First question comes from John McGrath from TVO. Please go ahead.
Good afternoon, Dr. Williams.
John.
I'm wondering about the decision not to require compulsory testing when a student falls ill in an elementary or high school setting, given that the testing has been the way that the province has relied on collecting the public health data. Is there not a concern that you could see outbreaks, that outbreaks could happen in schools, but that the public health system might not necessarily record them?
So if I understand the context of the question, is testing when a child is ill in the school or classroom, as compared to just carte blanche mandatory testing. We have put in there that when a child is identified as being ill, well, first of all, if they're ill, they should stay home. And if the parents have any concern, they should have them seen by their primary care physician, healthcare provider, and ascertain whether they think they need to have a test, especially if some of the symptoms may be compatible with COVID. So even before they get to school, we'd rather they err on the side of caution and have the child checked out prior to that. And they can let the public health nurse know in that aspect, because there's going to be absenteeism recorded, and they're going to want to know from the school, why didn't student A or B is not in the classroom that day, and we want to make sure we're watching that. So we may know of cases of illness in the public health sector and positive cases even before they get into the school, which would be even better. Once their child is in the school, say they come and they're well that day, but during the day they become ill, they will be helped out of the class and then put in a separate place. And the administration, we understand, will be contacting the parent fairly quickly to see if they have the parent arranged to come in and whatever's works out at the time to pick up their child and then to have the child assessed. And that would include, if the physician requires it or if the parent wants to get tested, COVID testing, because we want to have one way to rule out COVID, especially if the symptoms are compatible. Two ways. One, with a test. And second, if the physician who says, I've seen this child many times, I've looked at them, they've got a condition X or Y, it's not COVID, I don't feel it needs to be tested, so they have their healthcare provider's assessment of the situation, and we have confidence in that as well. So we do want to have that testing done if it's necessary, and we will encourage that to be done if there's any suspicion at all of COVID positivity or risk of COVID.
Follow-up?
On a separate matter, apparently in the United States, the federal government is telling states to prepare for the possibility of a November vaccine. I'm wondering, is a vaccine on that timeline at all part of Ontario's contingency planning at this point?
Well, we're following along with our federal authorities. You've heard announcements, and of course, our procurement of vaccines is through a federal process, even our flu vaccine and our regular childhood vaccines. So we do it on a national procurement process. We've already in the aspect now of purchasing influenza vaccine. We're getting our influenza vaccine program ready to roll out. We hope, and as the minister has said, to have it a larger campaign than ever, and we want people to get vaccinated in a timely way as soon as the vaccine is available. The same would apply to a COVID vaccine, and we know the federal government has put some bids out to, retain vaccine if and when it's available, and there's a number of them. We've heard some reports on that. So we'll follow their lead if and when they get a vaccine that meets the criteria that has to be fulfilled before it's put out into public consumption, and to make sure it passes all the Bureau Biologics approval processes, as all vaccines must do, to ensure, first of all, that they're safe. And then we're going to be doing some aspects to understand how effective they are. So there's much to be done. Will it be ready in November? We have had no information yet from the federal government that would be the case as of this time, but we're continuing to watch and ask and see if and when it might be available.
Next question.
Next question comes from Randy Rath from CHCH-TV. Please go ahead.
Hi, Doctor.
Hello.
I'm wondering about the way COVID numbers are presented by each public health unit. Some report active cases, others report total cases or new cases, and the numbers don't always match with the provincial website. Why is there a difference in the way numbers are reported? Why aren't they? Why isn't there a standardized method of reporting across the province?
So it depends on the question you ask them. When we're looking at our data, it tends to be incidence data. That means new cases that when they come in. And we want those new cases to come in when they've been confirmed by the health unit. And that means their staff they may have a potential hear of a case. You may call the person up and said, no, that wasn't me, that was someone else. We gave the wrong phone number. So you may not be a true case. You want to make sure, was it laboratory confirmed? What was the case contact history? Was it a true positive? All those things there you want to ascertain before you enter into your data system and they say this is now a new case of COVID. If you're asked them how many cases of COVID are active at that time, that means how many people have been assessed and diagnosed as COVID and are still in their 14-day quarantine period. That number, as you can guess, is cumulative over a period of time. As some health units, those resolve and to clear up, that number will drop. So you want active cases, you want incident cases, you want presumed cases, or epi-linked cases. So there's many different ones. We're trying to simplify it in our data to say, in our overall approach, while maybe a day or two out, we would like the health units to get the laboratory data, the physician-reported data, and put that in, do their assessment of the individual, and then when they feel satisfied, they will put that into the recorded data so that we don't have saying one time it's up by 10, down by 20, up and back and forth, which would only be confusing to everyone, including the public. So we are doing our reporting, but you can ask the health units sometimes for more details and different types of data sources. But then you have to be able to interpret that to the public so they can understand why this is the one number and this is another number.
Follow up?
Okay, yesterday Dr. Tam released a statement about the added complications of physical intimacy during COVID-19. And she suggests that unless you have an intimate partner in your cohort, that you avoid kissing and you should wear a mask during sex. How concerned are you about intimacy during COVID, and do you have a message for people in the province about this?
Well, yeah, I just saw that today that Dr. Tam released a report on that. I think she was releasing on general and sexual health, and she went into putting in comments about COVID and transmission. All along, we have our methods and our programs on safe sex and all the precautions one needs to take. I think in this COVID reality, part of what we've been trying to say with our social circles is that your aspect of being within 6 feet of someone not wearing a mask is based on the fact that you become a member of a cohort or a social circle. That means you have isolated for the 2 weeks prior to that. You have been free of contact. You have no signs or symptoms. So our general sense would to say you should do that in the same approach. So the ones that you're going to have that involvement with, you should be assured that they're part of your cohort or social circle, that you have that knowledge base of their risk factors for the previous 2 weeks in that. Now, I think Dr. Tam was saying that may not always occur. Our recommendation still is that we want that social circle maintained. We want the 2 meter distancing if you don't know the person. We want masking if you're in closer contact for a short period of time, and how to do that. How that works out in intimate relationships, I think it's still, I would like to be very careful on that about making sure it's within the context of social circles and people that you have full assurance that you know about their risk of exposure or current symptoms and signs of COVID prior to any type of interaction, be it intimate or otherwise.
Next question, and this is going to be the last question.
Last question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hi, Doctor.
Hi, Rob.
Just looking at the weekly summary of cases, and I note that the proportion of cases with no known epi-link has increased from 36% a couple of weeks ago to 43.4% last week. That's a bit of a jump, and does that mean that the number or the proportion of cases where you have no idea where they came from is increasing, and does that point to unexplained community spread?
Well, it's a good question, Rob, and we're looking into that to understand why that is the case, especially as we're doing large volumes of tests and our percent positivity has remained below 1% for quite a while now. We've been going between 0.5 and 0.7, and trying to address the issue where we've seen some people sometimes without any reason say they have no signs or symptoms and they have no contact they know of. They just want to get tested for the sake of get testing. And we find they have a positive test, but when we reassess that and test some of them, they find that the repeat test comes back negative. So we're trying to ascertain, is that a part of the issue here? And we're trying to look at that right now with our experts at Public Health Ontario and trying to understand, is that a factor in the whole aspect? As we're one of the few jurisdictions in Canada that's doing well over 20,000, 25,000 tests a day, and still with a positivity rate that is down well under 1%, whereas some of the smaller provinces and territories, as they're doing more testing now, their percent positivity is quite a bit higher than that, but they're dealing with a smaller number of tests. So these are part of things we're trying to address, and like yourself, we're asking ourselves questions, why is this going up, and what's the reasoning behind that? Knowing that when we ask people, they say, well, I don't recall any contact, and I wasn't that symptomatic, I just was worried, and I wanted to get tested. So we have a lot of people, I think, going forward and getting tested when they're asymptomatic, but have concerns and want to get tested. And as the Premier said, they are allowed to go forward and get tested. So we have to put that into the mix as well, where some other provinces are only testing people with symptoms or with known contact with cases.
Follow-up, and this is going to be the last question.
Thanks for that, Doctor. Just to follow up on that in a way, the last couple of days we've had some pretty stern warnings from Toronto Public Health about saying we're seeing a resurgence and whatnot, and the numbers have been high in Peel. So I know the positivity rate you're saying is down around half or 0.7%, but are you starting to get a little bit increasingly concerned about what we're seeing with these numbers? We had a couple of clusters at Yorkdale and Sherway malls the last few days, which that's the kind of thing we haven't seen since last spring.
Well, yes, it does concern me because we were well under 100 for a week or so, and then we bumped up higher. I'm glad we've stayed in the below 150. And I'm hearing from the health units, as I talk to Peel and Toronto, dealing with clusters around social events, doing workplaces. We have different ones happening in different locations in health units. And so we see this activity where a group or individuals decide to be very casual and careless, and they're having get-togethers, and sometimes people who should be in quarantine are in that group and gathering. And there's a sense if someone's not that sick, it doesn't really matter. Well, it does matter. And we've seen, as we said, the one I was talking to Peel, where they had an outbreak, I think was related to a church-type function. They went from 7 up to 17 overnight. So it's not benign. It's not a non-issue. And people are saying, I think this fatigue, or sort of tired about it, saying, do we really have to keep doing this? And when you see these jumps and these numbers, and they're not related to widespread, they're related to a cluster here, a group here. And when you add a cluster in 4 or 5 or 6 health units of another 10 or 20 people in a gathering, the numbers can stack up pretty quickly. And you're seeing that in the other provinces and territories as well, as they're trying to keep the public engaged in the principles of public health measures. So it is concerning, and we're going to do some assessing of what is the adherence to the measures and how do we encourage people to stay the task. I know it's a long run, but it's just the way it is with these viruses in a global setting where we can control what's going on in other parts of the world, and we have still some people moving around and coming in from there. And it's come to our attention that some people coming in have not maintained and followed the federal quarantine law and have broken quarantine and are out in public settings. So these are all very concerning issues to myself and to our team here in Ontario, and we're trying to address that to see can we wrestle these numbers back down again and get these social, communal outbreaks down.
Thanks, everyone.